Hello everyone, welcome back to my channel. So today we'll diagnose the disease based on two symptoms, two signs and two investigation, which is also called as rule of two diagnosis. So we are having two symptoms, muscle pain, dark urine. Two signs are muscle tenderness, facial puffiness, and two investigation is serum creatinine phosphokinase is elevated, which is a muscle protein, and blood in urine is positive. So take your time and pause the video and tell me the diagnosis. So I'm going to tell you the diagnosis, which is rhabdomyolysis. So what is rhabdomyolysis? Rhabdomyolysis is a muscle breakdown which is caused by the muscle injury and which releases chemicals like protein known as myoglobin in the urine and in the blood. And rhabdomyolysis has a triad of muscle pain, muscle weakness, dark red or brown urine. So this is our question and subscribe to my channel for more diagnostic videos. Thank you.